so prior to coming in, I would check the MAR for the order of the IV medication, make sure that matched with the medication order and with the actual medication. When I came in, I would gather my materials, which I have, and when I came in, I would close the curtain for privacy. So, hi, my name's Alicia. I'm going to be one of your student nurses today. Can you go ahead and tell me your name and date of birth? Alright, Henry Williams. And do you have any allergies we should know about today? Penicillin. And do you have any allergies to any sort of gloves or adhesives? No? Okay. So I would make sure the patient's in bed, and I would have them in a low Fowler's position. So I have that arranged. I'm going to do my hand hygiene. Alright, so I'm going to start off. I already have this out of the package. So I'm going to swab this end port. Okay, throw that away. And I'm going to connect my saline. Right. And I would just go ahead and clear that. Okay, and I'm going to stick that back down. So now I'm going to palpate for a vein. Right here. And then I'm going to apply my tourniquet. And if they're 3 to 4 inches above the site, if there were any hair, I would shave it, and if it was visibly soiled, I would clean it with soap and water first. But he looks nice and shaved and dry. Alright, so now that I got that on there, I'm going to check for a radial pulse to make sure it's still present. All good, and I would instruct him to place his arm below the level of the heart. Alright, so still have being present. Going to put on gloves. And apply the protectant. Alright, now I'm going to hold the skin taut about 1 to 2 inches below my insertion site, and I don't want to touch it to my insertion site. Now I'm going to insert bevel up. Alright. Now I got my needle in, I will hold it still while I insert the rest of my catheter. I'm going to quickly pull my needle out, this, and connect my cord. Okay. And now that that is connected, I'm going to pop my tourniquet. And I am going to push my saline back to ensure blood flow, which I have, and then I'm going to push my saline in, and while I'm doing that, I'm going to clamp that, so we're all good. Now I'm going to take this down. Maybe. Okay. ahead and tape down. Alright. Now I'm going to go ahead and just make sure that I can clean this up a little bit. Right, now I'm going to disconnect my saline and apply my Tegaderm, making sure that I'm getting it over to where this is able to be seen through there. So I always have a good look at my insertion site. Alright, now I have my Tegaderm on. Again, where I can always see my insertion site. And now I would take off my gloves and perform hand hygiene. And I would explain the importance of keeping this visible so that I can always assess. And I would lower the bed back to a low and locked position. Make sure that you don't have any questions. Do you have any questions, Henry? No? Okay, well I will be back to check on this. We are going to start to get your antibiotics and your fluids started, okay? Okay, thank you.